Hey everyone, welcome back for another deep dive. You guys requested this one. We're going to be talking about some weird neuro stuff going on with Shiba goats over in Japan.
Yeah, should be a good one.
It's going to be really interesting.
Yeah.
So to get into it, the source material we're looking at is a 2024 research article from the Journal of Veterinary Medical Science. It's called 3 Cases of Paresis Due to Vertebral Abscess in Shiba Goats in Japan.
Catchy title. Right.
Very catchy.
Yeah.
So we're dealing with paresis in these goats, which, weakness or paralysis. And right away you'd think,
cerebrospinal psoriasis.
right, like that's the classic goat paresis problem.
It's just what we'd all be thinking, yeah.
Yeah.
Pretty common parasitic infection.
Exactly.
Plot twist.
Plot twist. That's not what it was.
I love those.
Yeah.
Okay, so tell me about these cases. What were the symptoms?
Well, we had 3 Shiba goats. All of them had either lumbar paralysis or they had some obvious problems with their gait, like difficulty walking, stumbling, that sort of thing.
Okay, so pretty clear neurosigns. What'd the vets do? Well, they thought it was cerebrospinal psoriasis, so they treated with ivermectin.
Makes sense.
You'd think, right, but
It didn't work.
didn't work at all.
Big red flag.
Yeah, so they're thinking, something else must be going on here. So they did necropsies on the goats.
Nah.
Big surprise, they found big abscesses near the spine in all 3 goats.
Abscesses. Hold on. I thought we were dealing with a parasite.
Right, it was a surprise. The abscesses were pressing on the spinal cord.
Ah, okay. That makes sense then. So that's what was causing the problems. Let's go through the cases one by one.
Okay, sure. So case 1 was a 23-month-old male goat, and he had an abscess right at the T5 vertebra. Case 2, that was a 92-month-old female, and she had an abscess spanning the T5, T6 vertebrae. And then case 3, 37-month-old male, this one had an abscess at C7, T1.
So each abscess was basically right where the paralysis or gait issue was. Huh. Interesting. Is this like a common thing with goats and paresis?
Yeah.
Abscesses? I mean,
No, not really. Cerebrospinal psoriasis is way more common. Finding a vertebral abscess as the primary cause of paresis in a goat, that's pretty unusual.
so this is a pretty important finding then.
Yeah, definitely.
So what did these abscesses look like? Were they just like full of pus?
They were pretty weird, actually, described as milky white, caseous, and solid.
Caseous.
Like cheese.
Cheesy abscesses. Never heard of that one. Did they figure out what caused them?
They did in one of the cases. In case 3, bacterial cultures showed Corynebacterium pseudotuberculosis.
Isn't that the bacteria that causes caseous lymphadenitis?
Yep, that's the one. It usually causes abscesses in the lymph nodes.
So in these goats, it decided to go for the spine instead.
Exactly.
So how do you tell the difference between, cerebrospinal psoriasis and a vertebral abscess when the early symptoms are so similar? That seems really tricky.
Yeah, it can be. But there are some clues. For example, cerebrospinal psoriasis is linked to mosquitoes, right?
Right.
So it's seasonal. But 2 of these cases happened outside of mosquito season in Japan.
Ah, so that's a good indicator that maybe it's not psoriasis.
Exactly. Also, all 3 goats had blood work that showed signs of chronic inflammation.
Like what?
Increased neutrophils, low albumin to globulin ratio, that kind of stuff. That can suggest an ongoing infection, like maybe an abscess.
So if the timing seems off and the blood work's suggestive, what then? How do you diagnose a vertebral abscess?
Well, that's where imaging comes in. In case 3, the vets did a CT scan, and that showed spinal cord compression. So that pretty much confirmed it, even before the necropsy.
Wow, a CT scan can really be a game changer then.
Yeah, for sure. The study authors really highlighted how useful they can be for diagnosis and prognosis, even though they're not used routinely in, farm animal practice.
So to summarize, if a goat comes in with paresis,
Don't assume it's the usual suspect. Vertebral abscesses need to be on the radar.
what else?
The ivermectin response or lack of response is really important. If it doesn't work, you got to think about other possibilities.
Right, so lack of response to ivermectin, another clue. Anything else?
Blood work, look for those signs of chronic inflammation.
So we've got timing, ivermectin response, blood work, and then imaging can really clinch the diagnosis.
Exactly.
This is really interesting stuff.
It is. And that brings up another big question.
Ooh, I like where this is going. Don't go anywhere, everyone. We'll be right back to discuss this big question and get even further into this case study.
So, given how tricky it can be to diagnose these conditions, what else could help vets tell the difference between cerebrospinal psoriasis and vertebral abscesses in goats?
That's a great question. I mean, we've talked about seasonality and blood work and how CT scans can really help. But are there other tools that could be useful?
Yeah, for sure. The researchers actually mentioned that cerebrospinal fluid analysis, or CSF, analysis.
CSF analysis, okay.
That could be really helpful too.
So how does that work? What are we looking for in the CSF?
Well, with cerebrospinal satiricis, you often see eosinophilia in the CSF.
Eosinophilia meaning?
They'll see eosinophils.
Okay, so lots of eosinophils in the CSF.
Or points towards a parasitic infection.
Like satyriasis.
Right. You wouldn't really see that with a bacterial infection causing a vertebral abscess.
So that's a pretty helpful clue then.
Definitely.
Did they do CSF analysis in these cases?
No, they didn't, but they pointed it out as something that vets should think about.
So they're basically saying, hey, don't forget about this tool.
Exactly. Be thorough. Consider all the possibilities.
Always good advice. It really shows how veterinary medicine is constantly evolving.
For sure. Always learning, always trying to improve.
This whole deep dive has really highlighted that. So we've talked about how tough it can be to diagnose these conditions, but what about prevention?
That's the real key, isn't it? Catching it early, or even better, preventing it in the first place.
Exactly. So how do you prevent cerebrospinal satiriasis and vertebral abscesses in goats? Where do we even start?
Well, with cerebrospinal satiriasis, it all comes down to mosquito control, right?
Right, because it's mosquito-borne.
Yeah. So you got to reduce the risk of transmission as much as possible.
So how do you actually do that on a farm?
It's all about managing the environment. Get rid of standing water buckets, puddles, anything like that. Those are mosquito breeding grounds.
No more mosquito nursery.
Exactly. And then you can also use insecticides like sprays or topical treatments.
So you hit them with a 1-2 punch, reduce the population, and protect the goats from the ones that are left.
Yep, that's the idea.
Okay, makes sense. What about preventing vertebral abscesses? Is that possible?
It's a bit trickier because these abscesses are often caused by opportunistic bacteria.
Opportunistic meaning?
They just take advantage of any weakness in the body's defenses. Like if a goat gets injured and bacteria get into the wound, that kind of thing.
Okay, so it's not like there's one specific bacteria to avoid.
Right, but you can make it harder for the bacteria to take hold.
How?
Hygiene. Cleanliness is key. Keep the pens and barns clean and dry. Don't overcrowd the goats and dispose of waste properly.
So basically make the farm less inviting for bacteria.
Exactly. And it's also super important to make sure the goats have strong immune systems.
Because a strong immune system can fight off those opportunistic invaders.
Right. So good nutrition is really important and minimizing stress.
Happy, healthy goats.
Exactly. And of course, if a goat does get injured, treat those wounds right away to prevent any bacteria from getting in.
So it's kind of like a holistic approach to prevention, just like we talked about for diagnosis.
Yep. Environment, hygiene, overall health, it all ties together.
This has been a really informative deep dive. We've covered so much.
It's been great. I hope our listeners are enjoying it.
I'm sure they are. Before we wrap up, I want to leave everyone with one final thought.
Okay, shoot.
So we've talked a lot about all the diagnostic tools we have now, but what about the future of diagnostics? What new technologies are coming down the pipeline? What's next for vet neuro?
Ooh, that's a great question. Lots of cool stuff coming up for sure.
I know, right? It's so exciting to think about. What are you most excited about? What's on the horizon for vet neuro?
Well, molecular diagnostics are really going to change things. I mean, imagine you could identify the exact bacteria causing an abscess with just a blood test.
Wow, that would be incredible.
Or even like a point of care test, something you could do right there on the farm.
No more waiting for cultures.
Exactly. You could get answers right away.
That would make a huge difference for treatment decisions. So much faster.
Yeah, definitely. And it's not just about identifying pathogens. Molecular diagnostics can also help us understand, like, the host's response to the infection.
I see. So you could tailor the treatment to the individual animal.
Yep. Personalized medicine for goats.
That's the future right there.
Yeah.
What about imaging? Any cool new developments in that area?
Absolutely. We've got MRI and PE scans coming up, which are even more advanced than CT.
So you could get even more detail, see those spinal cord lesions even better.
Exactly. Better diagnosis, better monitoring, better prognosis, all because of better imaging.
This is really amazing stuff. I feel like we're on the verge of some major breakthroughs.
It's an exciting time to be in vet neuro, that's for sure. It's all about pushing those boundaries, finding new ways to help animals.
I love that. Well, this has been an incredible deep dive. Thank you so much for all your insights.
It's been a pleasure. Always fun to chat about vet neuro.
A huge thank you to everyone for listening, and a special shout out to the listener who requested this deep dive. I hope you all learned some new stuff about these conditions and maybe even got a little inspired by the future of vet neuro.
From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.